यहाँ पे रहते नहीं? ये यहाँ पे नहीं रहते? Respected dignitaries of the dais, Dr. Khurana, Dr. Tarkisha Jain, first present chairperson NCH, National Commission for Homeopathy, all the eminent classical homeopaths, Dr. Farooq J. Master sir, Dr. Girish Gupta sir, Dr. Patel, Dr. Adil, and all the very senior faculties here, and all the principals, faculties, management, all my beloved students of UG and PG. So whatever my part was assigned, Dr. Kalpit, who is the main nucleus of this program, and we are very much thankful for organizing this type of direct interactive programs with the students, faculties, and our policymakers, practitioners. So the exact motto of this seminar is to the real integration of the practice, education, practice and research, as well as administrative. So it is working. So, okay, you keep it there. If it, I will see. Okay. So what was the part assigned to me? We are going, our time probably we are 20-30 minutes late, the scheduled time. So I will just go through the main points, whatever our chairperson already told, and repeatedly he emphasized on the competency based of the students, because this program is totally, it is not faculty development program, it is specially for the students. So what I should say, that is the integrated teaching, practice and research, CBDC driven transformation in homeopathic education. So you know CBDC. You know CBDC because now you have to know is because it is already implemented, first year, second year, third year, already the third year exam is here, and the fourth year, rightly it is the time of fourth professionals. So CBDC already for 3 years. So the key points, concept of integration, I will not go line by line or anything. I want to show you that how a student may be very competent enough. Repeatedly, I know that after these also, everyone will be telling you that you must be a very confident enough, you must be a very competent enough to tackle the patient. Because being a homeopath, it is our very unique opportunity, or you may say it is our advantage, that till date, homeopaths is very close to the patient. In your area, in your areas, whenever a homeopath is compared to modern medicine or any other practitioners, the general people, they think homeopathy is very close to me. He asks so many questions, through detailed case taking. I can narrate everything to him, even very confidential part to him, and he listen. He ask, he listen, he give time. So homeopathic physicians are very close. So it is the unique opportunity we should take. So whenever one becomes sick, first call come to one homeopath. In your, I am not talking only in the very town areas or only suburbs, also in towns, suburbs, in village, remote, whenever homeopaths are available, in little time, even unconsciousness, suddenly become unconsciousness, called to near BHMS doctor. So that unconsciousness may be due to very trifling ailments, which maybe without medicine it may be cured. It may be very serious like stroke. Stroke again may be of TIA, transient ischemic attack, or stroke may be of complete stroke like that. Stroke may be of RIND, reversible ischemic neurological deficit. So you have to know the fourth type of stroke as a student. So what type of? At least if you have nothing, it is not possible to any homeopath doctor or even allopath doctors to take the hammer with the pocket, but at least you have the keys of your house keys. Dr. Kalpit Sanghvi was talking about the lost keys of Mullah Nasruddin of Satyajit Roy. The keys, even by the key, you can see where upper motor neuron gone or not, just by the extension. So it is your competency. It is your confidence which you have observed hundreds of patients, thousands of patients lying unconscious, and you have done the upper motor neuron test in that patient, in all the, not only ICU, even in the general bed. So it is very important one. So what is CBDC? Academic transformation, integration of teaching and clinical practice, research orientation. इसमें ये है जिसमें लाइट जलता है, ये लाइट जलता है नहीं, लाइट नहीं जलता, ठीक ठीक ओके. So research orientation, skill development, multidisciplinary exposure, benefits of CBDC in homeopathic education, challenges, future outlook. These are our key points, but it is not the right time. Throughout the day it may take time. So I will focus only on the concept of integration definition. Integration means organizing teaching in a way that connects related disciplines instead of teaching them in isolation. I know in the first year we are very neonates, na, like first year. So we anatomy, physiology. Right now it is not only pharmacy, the three subjects. Right now Materia Medica, organ and even repertory, all the subjects. So it is isolation. Anatomy is something different. Physiology is something different. Materia Medica is something different. But no, in CBDC, it should be in integration. Just giving one example, just say for example, aurum metallicum. I was just going through one case of aurum metallicum. Aurum metallicum, Allen's keynote, Materia Medica. One line written, lacking in boyish go, underdeveloped testicle, mere pendant threads. It is in Materia Medica, and all the students of aurum metallicum, they memorize, read and memorize, read and memorize. What is the symptom of aurum metallicum of male child? Lacking in boyish go, mere pendant thread. What is mere thread? Sir, wo to pata nahi. At the same time, the anatomy, you are going through undescended testis. You are going through gubernaculum testis. You have gone through the embryology, how that gubernaculum sac, why it comes, the testis, why it comes undescended testis, what happened to undescended testis, what is gubernaculum. So these anatomy and this understanding of aurum met, if it is be integration, not in isolation, during teaching part by the teachers, by the students also, they have to, it is not only the clapping whenever anything is teaching, the responsibility goes to only teachers. You are also responsible. Self-learning is today's, right now you are also, everything, having the self-learning through your smartphone. Why not education? Why not your self-improvement? Self-improvement is the most important part today. You improve yourself. You not to consider your friends, your colleagues, your college, your faculties. You improve yourself. Your total homeopathic profession will improve the quality. So self-improvement is also very important part, but you have to be very critical thinking. Sir was talking, Dr. Khurana was talking about the research aptitude from the very beginning, BHMS. Yes, it is not only spoon-feeding education of first year, second year, third year, 6 years time, 5.5 years, 6 years time, enough time to become mature. Even before that you were mature, 18 years legally. So it is enough time to be matured to know the integration and to develop the critical thinking aptitude. क्यों हो रहा है, कैसे हो रहा है, सर क्यों बोल रहे हैं, सर किस एक्सपीरियंस में बोल रहे हो, कौन सा रेफरेंस बोले हो, वो रेफरेंस देखना है, ये रेफरेंस भी क्यों बोले है. डॉक्टर केंट ने बोल दिए विल अंडरस्टैंडिंग इंटेलेक्ट, उसमें थोड़ा सा वितुल का इमोशन भी जोड़ दिए. क्यों जोड़े? डॉक्टर केंट विल अंडरस्टैंडिंग इमोशन क्यों करे? पीजी का तो ये आना चाहिए ना, अगर यूजी का ना भी आए तो. क्यों केंट ने उसका प्रीफेस में एक्नॉलेज किए थे हैनीमैन का साथ और एक को, वो असाइनमेंट है आपका, आप सबको, कि किसको, और केंट फिलोसॉफी का प्रीफेस में वो हैनीमैन को छोड़ के और एक को, ओनली एक को एक्नॉलेज किए थे, कि उसका आधार पे ही वो केंट फिलोसॉफी जो लिखा गया था वो किताब है. दिस इज द critical thinking aptitude. It's a part of research, because if you have not developed this critical thinking, you should be a critical thinker. Little bit of research aptitude is developed during internship, during final year, काम हो गया, आप पीजी में अच्छा स्टूडेंट बनोगे, और you will be a very good thinker, you will be a very good physician also. So promotes holistic meaningful learning, encourages understanding of relationship between basic science, clinical practice, research. That is what I was talking about, anatomy, physiology, materia medica. That was our horizontal part, and another one is vertical part, why already our chairperson told you. Few examples, very common examples, usually well known to you also if you have gone through my few lectures previously. Aconitum nap, in the initial stage of inflammation when localization takes place, Allen's keynote. So it is very common thing कि जब भी वो बॉयल अभी तक आया नहीं, लेकिन वो बोल रहा है कि यहाँ पे कुछ होने वाला है, यहाँ पे भी हो सकता है, यहाँ पे भी हो सकता है, वो बॉयल भी हो सकता है, वो फरंकल भी हो सकता है, वो एक्नी भी हो सकता है पेनफुल, वो और भी कुछ हो सकता है, लेकिन अभी तक कुछ हुआ नहीं. इन द एक्टिव स्टेज ऑफ initial stage of inflammation when localization not takes, this is the sphere of action of aconite. It may be in the part of your severe pneumonitis. Even pneumonitis not happen, you cannot see the x-rays, but the pneumonitis, the windows period is going on, and something is there in the early pathology stage where aconite, if you got the characteristic, if you got the ailments from, if you got the real dynamic cause, anything, suddenness, anything of aconite type of characteristic, 1 or 2 points, you think of aconite. Even in pneumonia, you think of hepatitis A. I am not talking hepatitis B. Hepatitis A, one part is there, prodromal phase, pre-icteric stage, when there is nothing in the serum bilirubin level, it appears normal. But patient having something, ठीक नहीं लग रहा है. Something, not only disgust to smoke only, mentally also disposed, but pathology, everything is something, pathology okay, but patient symptom is something not okay. Stage of aconite. If the ailments are there, characteristic of aconite are there, but you should know aconite from this stage. So knowing, understanding, and perceive, feeling, it matters. It is different. So you will be a very good student by vomiting this at the oral table, but you will be a very good physician when you will perceive the real meaning of aconite in your life, and it can be tested in the clinical side through your masters, through your teachers, himself. You apply during your house stepship, during your PG house stepship. Again, Ethusa synapium. Well known, lactose intolerance, Ethusa synapium, calcarea carb in small, in large, difference between Ethusa and calcarea carb, so many things. But have you gone through Allen's keynote, one line in the third line or fourth line, and it is in italics, idiocy, incapacity to think. Why this line in Ethusa synapium? This is your critical aptitude, critical thinking manner. This question should come in the later stage, not in the first year, but in the third year, fourth year, because you have to become competent enough. You have to be very, very confident enough. Have you ever gone through the symptoms of cerebral palsy? I am not talking that Ethusa synapium you will prescribe and cerebral palsy will be cured. But if you go through the symptoms of cerebral palsy, the vomiting of the cerebral palsy, the typical neck position of the cerebral palsy, no eye-to-eye contact of cerebral palsy, the idiocy of cerebral palsy, you can have the symptomatic feature of ethusosinopium which can produce the symptoms of cerebral palsy, and in the small to the very good elements of that cerebral palsy child, ethusosinopium may be the indicated remedy in most of these. This is your competency. So the same ethusosinopium, it is not only for lactose intolerance. It may be a drug of choice in cerebral palsy. It is your competence. Mercury in Parkinson's disease. You know the last line of Allen's keynote, paralysis agitans, trembling, so many things trembling. But most of the cases, inner trembling and this type of shivering, this is a sign of also our syphilitic predominant miasm. This is your competency. But mercury pathologically can produce, because if you go through the all mercury symptoms, accidental symptom, poisoning symptom of mercury, you can get so many symptoms of this. But only one line written in the last line of Allen's keynote, the paralysis agitans. So I am not talking that to all paralysis agitants you will give mercury. But mercury have the power to produce this symptom, and if you can get the syphilitic predominance with the typical mercury preparation, as per my knowledge is concerned, the best preparation of mercury as per Dr. Hahnemann was Mercurius vivus. So you can use these. Even it is not that mercury will trigger the dopamine or like that, but you can use it. May be not pathological, even the constitutional indications of Parkinsonism disease in a patient, if he is of mercury in nature, you have to know. I can recall one, when I was student, like you, I was intern or probably final year student, and I can recall very good famous homeopathic physician, Dr. S.R. Shah, late Dr. S.R. Shah. He usually sees patient more than 400, 500 or more than that per day. And in a lecture, he came just for 20 minutes, and in this type of seminar, that was just only, not this type of seminar, only seminar. So he told 5 cases, and he told in all the 5 cases that he cured nitric acid, he prescribed nitric acid, and all the 5 cases of anal fissure cured. And we took notes, and we also one asked, sir, written here, sir, another so many drugs, only nitric acid? No. I prescribed nitric acid, and nitric acid even 6 for very severe pain, and in one case 30. So we note everything. There was one very senior organon, retired organon, probably he was ex-principal also, one government college. He retired, but he was the chairman of that session. At the end of the session, you have to give your don't be deviated. So the chairman at the last commented, Dr. Shah wonderfully told about the cured cases. You all learned about acid nitric. I also learned about acid nitric, that acid nitric can cure the pain, the severe burning of any type of anal fissure. But we are lucky that we can identify acid nitric in 5 cases. As well as you should remember, all those 5 patients were also lucky that all those 5 were having nitric acid characteristic. That's why acid nitric cured. This was the competency. This was the thinking how homeopathy acts. Homeopathy can produce this symptom, but whether that is applicable to that stage, whether that is indication, or that is from your knowledge of disease, by knowledge of practice of medicine, you can identify which is of practice of medicine and which is of our indications, which is something not related to that. It is very, very lucidly written in the relation part of Allen's keynote, phosphorus. It's a very good drug for chronic diarrhea. The chronic diarrhea may be of different type. Chronic diarrhea may be due to diarrhea. Chronic diarrhea may be due to amoebic typhlitis. Chronic diarrhea may be due to intestinal tuberculosis. Chronic diarrhea may be due to anything related to anxiety. Chronic diarrhea may be due to acquired immunodeficiency virus, AIDS. But whether I am talking that phosphorus is curing the cases of AIDS, no. If the patient having the characteristic of phosphorus and having chronic diarrhea, you can give phosphorus confidently because you are competent enough that you know whenever you got the three characteristic at least, still the patient is in a stage. If the patient is not giving a single indication, you should know that this is the incurable stage. This is better to palliate. Even palliation by homeopathic principle regarding the all the methods, etc. So this is the basic difference between competency and knowing the subject. Not changing. This is one very important part, that is phosphoric acid and diabetic coma. In phosphoric acid, acid phos, it is written, you see the line, long succession of moral emotions, long ailments from, under first para, long succession of moral emotions, and one symptom is there, lies like a log. Why I am mentioned, intentionally I put that in the previous slide, diabetic coma. No, it is not diabetic coma. The symptom produced by phosphoric acid lies like a log. Lies like a log. These lies like a log may be in the 3rd or 4th week of enteric fever, typhoid state, coma basal, low muttering delirium, subsultus tendinum, everything and lies like a log. The same coma may be due to diabetes related coma. Diabetes related coma also, you know, there are two types of diabetic related coma, non-ketotic and hyperosmolar non-ketotic coma and ketone bodies coma. So lies like a log also from schizophrenia. Schizophrenia, withdraw, he or himself, वो अपने को सोसाइटी से अलग कर लिया, वो किसी का साथ बात ही नहीं करेगा, किसी का बात सुनेगा भी नहीं, बोलेगा भी नहीं, lies like a log, खाने का भी मन नहीं है, schizophrenic. So acid phos can produce the symptoms of these lies like a log. Whether these lies like a log is 3rd year, 4th year, 3rd week, 4th week enteric fever or schizophrenia or diabetic coma, it will be depending on your clinical knowledge of practice of medicine, Addison Davidson, and the indications whether acid phos is there or not, that will be also on your case taking. If you got this, the long succession of moral emotions, बचपन में उसका father, mother, parents चले गए, उसका बाद वो बड़ा हुआ, जिसका सहारा पे बड़े हुए वो भी छोड़ के चले गए, जिस सर्विस पे वो ज्वाइन की वो सर्विस का इंडस्ट्री बंद हो गया, जिसका साथ शादी हुआ था वो इंडस्ट्री बंद होने से चल गया, फिर उसका एक छोटा सा बच्चा था, वो बच्चा भी बड़ा होकर उसको नहीं देखा, एक का बाद एक की इमोशन, और वो अपने को सबसे हटा के लटा हुआ है, lies like a log. Maybe your prescription acid phos, this is the unique, your competency to know acid phos. So CBDC program is made just that not only the reading, memorizing and vomiting, to be a very competent enough. I will not only these examples, wonderful example, Rustux, very common drug. You ask anyone having osteoarthritis, अरे आप जब भी चलते हो फास्ट एग्रावेशन ना, आपका फास्ट एग्रावेशन होता है, धीरे धीरे कंटिन्यू ठीक हो जाता है, रस्टक्स. Very common prescription in interns or final year or even second year, third year student or even the senior faculties, which is very common, maybe Rustux like that. But what I emphasize, the same, what is the basic pathology of Rustux? Sphere of action of Rustux is in the muscle. So the same Rustux can be used in ventricular hypertrophy whenever the right ventricle or left ventricle in strain. Due to strain, overuse of heart, you think it is written in Borix, William Borix, here not Allen. It is very wonderful, like calcarea floor in the atherosclerosis, like Rustux in ventricular hypertrophy. Whenever there is exertion, whenever it is not only exertion due to wet carriage, it is not only due to high, that is another indication of injury type of Rustux. But the same exertion, same overstretch of the ventricles during the failure state give you indication of Rustux. Rustux can be thought also like this, your competency. The same Boric, one line, it aborts abscess in the rectal area, you think of ischiorectal abscess. Repeated ischiorectal abscess gives birth to even fistula with the tubercular diathesis. But Rastux, if you got the history, that patient having history of sitting more than 10 hours, 12 hours, or cycling of 8 to 10 hours regularly, and having so much exertion on the ischial tuberosity, you think of ischial tuberosity of our applied anatomy. This is our horizontal integration. That ischial tuberosity, what are the muscles from ischial tuberosity, what are the hamstring muscles, everything that got very much tortured. Think of Rastux. Rastux will work in that abscess also. It will abort the abscess. So this is the beauty of homeopathy, which you should know. Whenever you should know this from the very first year, second year, third year, or at least you should develop to how to frame question to your faculties, or how to not only to faculties, to yourself. Try to search out from the library books, from everything is in the smartphone. Not the everything is very good in the internet, but your teacher, your faculties will guide you which is good and which is not good. I will skip this EPICA of LVF. So types and framework of integration, that is the horizontal integration. Another one is vertical integration. And in the vertical integration, linking basic sciences with clinical subjects across academic years. Basic sciences. Can you imagine, during our postgraduate phase at National Institute of Homeopathy, I did my MD in organ of medicine at NIH, we were given assignment to go through the theory of physics in the part, because organon aphorism 5, it is written that which is the most probable exciting cause. किसी ने रात को खाना खाए 2 बजे, उसका साथ ड्रिंक भी लिया, उसका साथ उसका आने का टाइम में बारिश में भीग गया, तो उसको क्या दोगे आप? लेट नाइट, फैट एग्रेवेशन, दारू पीने का वो, या ड्रेंचिंग हो गया, तो रस्टक्स होगा, नक्सभूमिका होगा, पल्सिटिला होगा, उसका कैरेक्टरिस्टिक क्या होगा? सो डिफरेंट, सो मोस्ट प्रोबेबल जो होगा उसका सबसे करीब उसको ही आप दे सकते हो. So theory of probability we have assigned from 2 physics books to integrate with the concept of aphorism 5 of organon of medicine. This is your competency. This is your competency. This is the competency of a postgraduate scholar at a good institute. This is your competency. So these last part, there is the integration of teaching, practice, research. Research question, whenever you develop any question, I can remember one of my very senior guru at my Mahesh Bhattacharya college, he used to give all to Helleborus 6 in pruritus vulva. I never got anywhere about this, because I have gone through anything and I found that Helleborus is a very good drug for diabetes insipidus. It can produce the symptom of diabetes insipidus, in which 40 liters urine per day can be excreted, which is normally 1.5, that is the 40 liters. So it is our water balance. It is under ADH, antidiuretic hormone, which can again take 38.5 liter. So that ADH part, that ADH means posterior pituitary. I am going through horizontal integration. So your pituitary, your posterior pituitary, your ADH, your hypothalamus satisfaction, your water reabsorption 38.5. Whenever there is any tumor in the posterior pituitary or anything, ADH cannot function. So total 38.5 and 1.5, 40 liters can pass. And whatever the symptoms that can be produced by Helonius 6, the same remedy, one of my master is talking that it is a remedy of pruritus vulva. How? Till date, I am searching. This is my critical thinking ability, which ये सोने नहीं देता है. ये बोलता है, or he was successful, but I am never successful with this, using this, more than 40 to 50 cases. But he was successful in every case. Why? Still I am searching for. Even I am searching to his classmates, his students, why he was with these Helonius. So this type of, the last part, that is the research aptitude, you should develop. I will skip this one. 11 levels of integration. This is the higher levels, is the full integration. I will skip all this, because these are the for faculties. These are not for the students. But in isolation, these should not be. I am in teaching profession. Before that, joining here for 2 months, I was in teaching profession for 26 years. And I have seen salivation to the students whenever any subject of anatomy, physiology, practice of medicine, surgery, gynae-obs. And I have seen the shrugged shoulders whenever it is pharmacy, whenever it is organon. Why? Why organon? The organon, to correlate organon with the practice of medicine, because everything we have a challenge that you show me uncommon peculiar PQRS of Mathematica, and I will show you this is of Mathematica, this is of practice of medicine written. This is not your uncommon. So make it gamification. This is one part to become a competent enough. Small group teaching, small group discussion, not only in the classroom. In classroom, one type of lecture. In small group, another type of lecture. Our chairperson was talking about the group teaching. You know, there are right now, the autism is a burning problem. But you think how one become confident that these, the same autism, there are so many varieties of autism, Tourette symptoms, dyslexia, learning disability, so many things. But don't you, your feel-good hormone will secrete whenever you will think that most of the thing there is no organic damage. Exception is there, some organic damage may happen, but very rare. Mainly it is functional. Our sora is functional. Our sora is functional. And the basic sora, king of sora, you just think of causticum, Tinctura acris cynically, one of the very good antisoric. And you think of rubric mistakes often, causticum, single remedy rubric, learning disability, calcarea carb, learning disability. I am not talking that in all learning disability calcarea carb will work or causticum will work, but whenever you can establish the correlation that this is in homeopathy and this is in, right now, last cinema of our Amir Khan, first cinema was on dyslexia, that was Tare Jamin Par. Right now it is Sitare Jamin Par. He showed wonderful thing that is invisible autism. Everything is normal, but he is autistic. And he is very good. He was very good basketball player, but he was invisible autism. No organic damage, typical sora. But that sora is totally perverted sora. Sora can pervert everything. Sora can pervert your mind so that you will go to syphilitic and psychotic type matter. So your perverted sora, if we got it, if we can correlate it, then why you feel inferior that it is homeopathy, it is it is homeopathy far ahead. Far ahead. The understanding in the language of science is still unexplored, but it will be explored. Already explored so many things. Application, the chronic blue condition. Even this patient is still alive with chronic blue condition, and we gave ignatia, and the patient having, this is a documented case record. You can get it at National Institute of Homeopathy because it was documented, and his left bundle branch, totally LBB was there. LBB. Usually right bundle branch block is not so very important, but LBB matters. But it very important, this case improved. So just you see the understanding, because Dr. Sanvi told me, just show to few glimpses how you can correlate. You can see the lady suffering from osteoarthritis, but what is most important part, his son is there, but the typical Staphysagrida pattern with his wife of son's wife, उसका बहू का साथ उसका कुछ भी नहीं जमता है, बोल भी नहीं पाता है, क्योंकि सन फिर उसका ऊपर खिला ये हो जाएगा. वो मेरे कान में व्हिस्परिंग करके बता के गए, अरे जितने सारे बहू का लिए है, मेरा जो भी है वो बहू जब से आया है सब कुछ हुआ है. So how beauty homeopathy, the same Staphysagrida give you clue also of one mole there, and the exhibitionism. So the same, this is the interpretation. I am not talking, I am right in this sense. It may be interpreted by others, but the most probable right one will indicate you the right remedy. The same, you have gone through the one eyes of Phyllis Pite, not Phyllis Pite, uh, your art of interrogation. Art of interrogation, in one eye you can see the tear, in one eye you can see the another thing, the two eyes, the same thing. It was one older case of another hospital, government hospital. So epigenetics, right now, we are going through the era of epigenetics, and it is nothing new. Your accessory circumstances, what tells in organon, the same thing tell in epigenetics. On the basis of epigenetics, nowadays, obstetrics becomes social obstetrics. Social obstetrics. And you can't, by give your homeopathic remedy, you can change the gene, but we can have influence on the presentation of the genes. These presentations through epigenetics, we can have, our medicine can act. So you should know these conditions. So whenever you have to know one patient, you have to know your patient in your society. Go through the newspaper regularly. Go through the news. Go through what is happening around, because that is your not only longitudinal study of the disease, that is your cross-sectional studies, because you have to treat the patient of lifestyle disorders, chronic. And if you not knowing anything about your society, you can't treat, because most of the patient may require moral remedy. No remedy required, only moral remedy. Sir, Dr. Khurana sir was talking about pediatric psychology. Pediatric psychology, you should know that negative psychology is the common to pediatric psychology. If you say, अरे भाई दूध पियो, दूध पीना सेहत के लिए अच्छा होता है, कभी दूध नहीं पिएगा, और नेट्रम ग्रुप होगा तो और भी नहीं पिएगा. लेकिन जब भी आप उसको इग्नोर करो और बोलो दूध पीना ही नहीं है, वो दूध पीना शुरू करेगा 7 दिन का बाद, because you know the negative psychology of child psychology. That's why you should have the competency. So only BHMS pass is not enough just to pass and give honors. But how you will be we as National Commission for Homeopathy, we want every student after 5.5 years or 6 years can treat the patient from the very, not only treat, can preliminary diagnose. Being a BHMS, you can't place your stethoscope in the chest. If the murmur of congenital cyanotic heart disease, how can be missed by you? Because the same patient, after 3 years or 4 years, if go to another allopath doctor and he diagnosed that the patient has been suffering from congenital cyanotic heart disease, any ASD, VSD, phylostetrology, PDA, anything, and he told that, अरे डॉक्टर साहब मैं तो बचपन से इसको 4 साल से होम्योपैथिक दवा खिला रहा हूं, होम्योपैथिक दवा से तो कोई डॉक्टर तो हमको बोला नहीं कि इसका हार्ट में छेद है. So being a homeopathic doctor, we are the first one to treat the child, to neonates. So it is our duty to check everything. उसका सारे चीज, उसका आपको इंडिकेशंस भी मिलेगा, वहां पे माइasthmatic प्रीडोमिनेंसी मिलेगा, उसको जेनिटल ऑर्गन मेल जेनेटिकल ऑर्गन चेक करना, वहां से आपको सिफिलिटिक प्रीडोमिनेंस देख पाएंगे आप, उसका हेयर, उसका बोलने का ढंग, उसका क्लेफ्ट पैलेट, सारे चीज में आपको मायाजिम दिखेगा. और वो मायाजिम का साथ और वो सिफिलिटिक प्रीडोमिनेंस का साथ कभी भी डिजीज का सिफिलिस गड़बड़ मत कीजिए, वो डिफरेंट है. प्रैक्टिस ऑफ मेडिसिन, नॉलेज ऑफ डिजीज और इंडिकेशन इज समथिंग डिफरेंट. सो सीबीडीसी पॉलिसी, आई विल 2 or 3 slides I will only make. These are the core pillars of CBDC implementation: competency mapping, interdisciplinary modules, case-based learning. I have seen lot of case-based learning from our masters like Dr. Farooq J. Master. Since my childhood, I was student. I was fond of his small books at Vijay. I have seen that case-based learning, how it can be. Structured internship exposure, undergraduate research orientation, clinical data utilization. So outcome driven, everything, the faculties know that whenever you have gone through this program, that everything is outcome based. So this is very important part, that you should know why I am. It is not that only it is written arnica apoplexy, loss of consciousness, and it is written in the arnica says well when he is euphoria. Every stroke patient, every cerebrovascular accident, previously it was called CVA, now it is stroke. Cerebral stroke, having euphoria, or if his consciousness is little bit there, whenever you will ask anything, that how are you, kaise ho, theek hai, aap kaise hai, but he will be dying. Maybe after 4 hours or 5 years he will be dying, but he is talking, aap kaise ho. मैं अच्छा हूं, कभी कंप्लेन नहीं करेगा। ये स्ट्रेमोनियम का नॉट कंप्लेनिंग नहीं आएगा, इसमें आर्निका का आएगा जहां पे सिविलिटिक प्रीडोमिनेंस है और आर्निका का जहां पे एपोप्लेक्सिया है, ये डिफरेंट। द सेम थिंग व्हेनेवर यू विल आस्किंग टू एनी चाइल्ड अप टू एक्सेप्ट 3 इयर्स, 1 to 3 इयर्स, व्हाटएवर यू आस्क ही विल रिपीट। आपका नाम क्या है? मेरा नाम क्या है? आप कहां पे रहते हो? मैं कहां पे रहता हूं। 1 to 3 इयर्स कॉमन, 1 to 4 इयर्स इक्वल common, but the same thing if it continues up to 12 years, 13 years, Tourette syndrome, autism spectrum disorders में आ गया वो। The same thing it is written in जिंकम मेटलिकम, तो आप सारे को जिंकम मेटलिकम दे दोगे। एलिमेंट्स फर्स्ट जिंकम मेटलिकम में लिखा है कि सप्रेस्ड इरप्शंस इफेक्ट फ्रॉम, एक पॉइंट है और वहां पे भी है कि रिपीट द वर्ड जिंकम मेटलिकम का। So this type of competency you should develop, constant integration. Even you are going through the bus, you are going through your scooty or anything, and you are observing anyone, in the policeman, something, कुछ आपको लगा कि इसका कुछ है, तो ऐसे नहीं कि एक्सीडेंट हो जाए, लेकिन आपको दिमाग में तो ये डाल दो कि क्यों ये ऐसे कर रहा है। इसका टिक्स, एक किसी का टिक्स है, ऐसे ऐसे कर रहा है, किसी को उसी टिक्स को कोई दवा का जरूरत नहीं, आप उसको एक बार देख के एक थप्पड़ ठीक हो जाएगा टिक्स। So these are the common things, because practice of medicine, common sense is very very required, which is कहां पे वो फिजियोलॉजिकल है, कहां पे वो पैथोलॉजिकल जा रहा है। ऐसे कहीं पे है जो फिजियोलॉजिकल और पैथोलॉजिकल जो डिमार्केशन है वो डिसॉल्व हो गया है, डिसॉल्व हो गया है। सो दिस इज अ वेरी इंपॉर्टेंट पार्ट। राइट नाउ अभी पीयूडी में हो रहा है ऐसा, पेप्टिक अल्सर सिंड्रोम में। So reframing homeopathic medical education, administrative perspectives on CBDC integration, philosophy-centered curriculum policy, integrated curriculum framework, dynamic policy approach, continuous feedback. You give your feedback. Whatever you are lagging, we will be listening you, we will be interacting you, we will be replying you. So continuous feedback, curriculum design, NCH implementation oversight, faculty development priority. This is very important part right now. CBDC framework and the evolution of integrated homeopathic education, teaching, practice and research synergy. Last part, that is the student participation in clinical research, institutional ethics committee strengthening, encouragement of publications and presentations, alignment with broader traditional medicine standards recognized by the WHO. These are the very big things. I am not going through details, but you should know one thing, that you have to learn. At least 1 hour, 30 minutes or whatever, even if you are not learning your textbooks, at least you read any good books or any good newspaper or go through any good newspaper channel. You should enrich yourself for a homeopathic physician. It is one of your criteria. It is not that Hahnemann told everything in organon of medicine. Hahnemann was so clever, he put one word etc. in 67 places of 6th edition, 67 places etc. You make your organon up to date. You add your that it's you can understanding, you can have understanding that etc. part you can add. So organon you can make update. So teaching dimension in CBDC homeopathy, critical thinking and decision making, real world clinical scenarios, that is case based and problem based. Very important, the problem based. I already told. The Natrum Mure, Allen's second line, old, last 2 lines, fluttering sensation of the heart shakes the whole body. It is in the Natrum Mure. And one is reading, memorizing and vomiting. Natrum Mure, fluttering sensation of the heart shakes the whole body. It is the typical iron deficiency anemia in which hyperdynamic circulatory state is going on. That's why hemic murmur also can be found, and that can be cured by if from outside iron, if it is from only deficiency, if it is not of deficiency, if the patient is of Natrum Mure, give Natrum Mure. Natrum Mure may be pathological simillimum to all iron deficiency anemia, but only the typical characteristic of Natrum Mure, if the patient have, you give Natrum Mure, it will work. I am in the last part. I am in the last part. I know. So everything chupa hai, anamnesis in homeopathy. Even you can see the microbe is nothing, the terrain is everything, the soil or land, your accessory circumstances, your epigenetics, it is everything. So know the society, there is a chronic disease 5. Even the Drosera, not only for whooping cough, the tubercular background, it is a drug of choice in rheumatoid arthritis right now. Considering the tubercular background, so there are so many things. Even this is very important one. There is a fatty liver, free fatty liver to try VLDL. I am not. It will take more than 20 minutes time. So, but fatty liver right now it become very non-cirrhotic hypertension like that, portal hypertension. These are only lifestyle disorders. We will. The last one slide, I will give you one question to all, that what is this? Please, from student part, you diagnose this. The student or final year student or intern or PG, what is the condition the patient has been suffering from? What is the condition? Any clue? It is not that direct, only from this, seeing this. What is the first one will come to your mind? Whenever you will be a competent BHMS graduate, you should have idea of these diagnosis. Anyone from the student? Anyone? Any what disease? This is aged, 70 plus aged male patient, and lying with. So what may be the diagnosis of the disease? Anyone? Huh? No, not arthritis. It is simple neck femur fracture. It is no disease. Neck femur fracture, the typical position. Just entering the room, if the patient lying that and 75 years of aged, and if you got the history of fall, without history of fall history, just you see the posture, in the left side you can see this is your competency, which will guide you to diagnose, which will guide you to reach you the minimum, to identify the indications. The National Commission for Homeopathy want that each and every student, we know that good students are always good students. In every circumstances, they are good student. It is our challenge that the average student, the below average student, the special childs, all should be competent enough, because all the students will be the doctor. And the community, they have no idea who is good, bad, mediocre, and that. He knows that you are a BHMS doctor. So it is our responsibility that each one should be a very competent doctor who can treat even the primary to tertiary care. Thank you.
थैंक यू सर, थैंक यू फॉर अ वंडरफुल. मुझे लग रहा है कि पूरे दिन का सर सेशन का रखे ना, तो मटेरिया का लाइव मटेरिया का वॉक थ्रू मटेरिया का है, एंड द केस इज ऑल्सो शोइंग. This suggests one thing very powerfully, कि even teachers and the principals who suggest they feel like a clerk, they are not clerk. Even sir was principal for so many years, and now president education board, and still is in touch with the clinical aspect. This is what is expected by NCH, by CCRH, for all the stakeholders should be continued activity through clinics. We are moving fast, we are getting late. हम लोग 2 सेशन में करेंगे, क्योंकि आधे घंटे लंच के बाद some of the speakers and dignitaries will depart because their flight is there. तो any questions you can send it before that. हम लोग 2 चेंज करेंगे, डिस्कशन भी हो जाएगा, एक क्विज करेंगे. हम लोग हर रोज सेशन के बाद करते हैं. Before lunch and before the concluding the sessions, we'll be having a quiz. We'll be asking you the questions through the sessions, so we'll be aware कि outcome क्या है, सिर्फ यहाँ से deliver हुआ है या वहाँ पे कुछ receive भी हुआ है कि नहीं हुआ है. And participants who are successfully answering this, हम लोग raise करेंगे और उसको prize भी देंगे. As you all know, this is a good handsome prizes for that. So keep attending this session with this is for you, right? So before lunch, we will be having quiz also and panel discussion also. Thank you. And that also after the session also same.